Here what we're going to look at are the measurements we do to decide if someone needs a NUCCA adjustment. What we're going to look at right now is to see if the shoulders are level. And we measure, and on her we see that her left shoulder is 2.75 degrees lower than the right shoulder. What we're doing now is we're doing measurements to see if someone needs a NUCCA adjustment. When things are out of alignment, the head will tilt to one side, and that causes the hips to want to lean to the other side, causing one leg to pull up shorter and one hip to drop down. So the measurement we are going to do is to decide if the hips are level. And in her, the left hip is 4.9 degrees lower than the right, indicating that she is not level and that she would need an adjustment. What we're looking at here is to see if she has a contracted leg, and what that means is one of the legs, if she's out of alignment, will look shorter than the other leg. Now the leg isn't shorter, the bones aren't shorter than the other side, but what happens is as the head goes one way, the muscles on the opposite hip will tighten up and pull that leg up shorter and make it look short. So if we look at her, she has, her left leg is about 1/4 of an inch shorter than the right, meaning that it is contracted and that she needs to be adjusted. This is a demonstration of the actual NUCCA adjustment. As we said, it is very light, it's very gentle. What we're doing is we're using the first bone at the top of the neck where it sticks out to the side, and with some very specific measurements we did off of some x-rays, we know the exact direction to put the force into this first bone, to use it kind of like a lever to get the entire spine to straighten out. So we did our measurements and we know that she needs to be adjusted. So now we are going to do the adjustment. We need to find the side of the... And that's it. That's all it takes to do the adjustment, and it actually looks like more force than it is, but it's just a very, very light pressure to this first bone. And if I can get this first bone exactly where it's supposed to be, as soon as I'm done, the hip should level out, the shoulder should level out, and everything should go back where it's supposed to be. And I need to do it a bunch of times because I'm only moving things a little bit each time I do this. Each time I do it, it only moves about the thickness of your fingernail, or about 3/4 of a degree. Because it moves only a little bit at a time, it takes very little force. Now we are remeasuring the legs, looking for the contracted leg, which means before the adjustment, this leg was pulled up short because the muscles in the hip were tight, reacting to the head and neck being tilted to one side. We did the adjustment. Now we look at the legs, and the legs are exactly even, meaning that the muscles have now relaxed, the leg dropped back down level, which means she is in alignment.